broken-hearted, I surely came. Sons that were slain for minimal gain. Youth that can't read, speech that can't talk. Passion to move, a love that won't walk. I speak to you, my heart and my soul. My family and folks who
Hello, and welcome to a new edition of Education is Best Medicine. And thanks for watching. Remember, community public access is your best bet. In our continuing series, we want to talk about infants, particularly African American infants. There's an excellent project in Berkeley, the Black Infant Health Program. I tried to get these ladies on for almost a year, and it was they're just busy, you know. Starla's busy, Dr. Alexander's busy, they're busy women. But finally they consented to come on, and what we wanted to have a conversation is about the state of Black infant health care, as well as specifically African American infant care as it relates to death and disability. And I wanted to get right into it. Starla, would you introduce yourself and some of your background in terms of the infant program?
Okay, well, my name is Starla Gay.
That's a nice name. I like that.
Thank you. I'm a participant with the Berkeley Black Infant Health Program.
Okay.
I've been participating for about 4 years now.
Okay.
I actually sought them out because I was with another program in Pittsburgh who really helped me out in a really tough time.
Okay.
So I'm a participant, and now I was invited to join the board as well.
Okay.
And I've gotten really involved in the process of trying to bring attention to the program and also to secure more funds for the program. So,
Dr. Alexander, introduce yourself.
Thank you, George. I'm Dr. Vicky Alexander, and I was the Director of Maternal Child Health for the City of Berkeley until I retired.
You retired?
I retired, man.
Get out of here.
Hallelujah.
Again.
And then I went back to work just a day
See?
and a half. It didn't work, retired, right?
Yeah, okay.
I went back to work a day and a half a week with lifelong medical care. So
Okay.
that's with whom I work now as a physician, as an obstetrician.
Well, you know, infant mortality, U.S. ranks 29th in the world.
That's
Cuba, you know,
That's right.
Singapore, you know. When, the analogy I like to give is that when I first started practicing as a physician's assistant in around 1984, African Americans were number one in infant mortality. Mm-hmm. It is now 2009, and we're still number one. Mm-hmm. What's going on? What do you see as issues from a participant in the program and from a provider?
well, what I believe is going on is the stress has not gone away. I think stress is the major factor in babies being born early and in babies dying early. I would say Black women have just a unique kind of stress. Black women in America have a unique kind of stress. And I don't think that there are many, there have not been many avenues to deal with this particular stress. Mm-hmm. We may be seeing more and more now, but for the most part, just Black women have not been dealt with in the manner that they should be, and we're the carrier of the children, and whatever we go through, we're passing on to our children while they're in the womb, and maybe that's why we see such elevated levels of infant mortality as well as low birth weight babies.
Okay. And early babies. Doctors, the studies speak to that? What information do we have that talks about that?
Absolutely. It's been very well documented that stress is critical to causing infant mortality and low birth weight babies. Mm-hmm. In Berkeley in 1999, we put out a report showing how difficult it is in Berkeley for African American women. And we actually did not look at infant mortality. We looked at low birth weight because we don't have that many births in Berkeley. Okay. So you don't really have enough of babies dying, it's a terrible thing to say, to be able to compare statistics. So we look at low birth weight in Berkeley, and it turns out Berkeley was the worst in the nation in terms of the disparity between white and African American low birth weight rates. And that's telling. Low birth weight is something that's caused by many things. Stress is the main one. Now, what causes the stress is very important. When we did the studies on this, we were able to sort out Education might be a little bit of it. Health indicators, hypertension, diabetes might be a little bit of it, etc. You can, educational level and economic level could be a little bit of it. But then still, there's a disparity. So we did a lot of work to look at, okay, so what is this stress factor? And what does racism have to do with it? And indeed, this is very critical. This day and age, we clearly say that the inequity is related to how we are treated as a people.
Well, interesting enough, I'm glad both of you came on, because I think that we need to kind of redefine why programs like the Black Healthy Infant Project, am I saying it right, are needed. Black Infant Health Program are needed. The need hasn't went away. We consistently see our numbers rank number 1, number 2, or whatever. And a discussion around preemie babies, as well as babies that, preemies. I always want to say babies that don't stay in the womb long enough, but preemie babies. What, are we seeing a lot more preemie in terms of premature births? And is that kind of more of a standard, what we were concerned about? Not only are the babies dying, but they're not even getting out the womb.
Well, one of the things we're trying to work with is premature babies and trying not to have premature babies. We know that if a baby is less than 5 pounds, 8 ounces, that's kind of our cutoff point for a low birth weight baby, that if it's less than that, later in life it's going to have more and more difficulties. Asthma as a child, as it grows older, difficulties with the educational system. Not all of them, but when you look at the data, it's something that we really have to pay close attention to.
Starla, you said that there was a connection with you in the program. What was that connection? And because it had you elevate to the board. So what starts you as a participant in the program to being on the board? Because we need to recreate whatever that's going on.
Well, I started off at the Black Infant Health Program in Pittsburgh. That was back in 2001. I was pregnant with my first child. The relationship was horrible. I was under an extreme amount of stress.
So I don't want to sit back, because when we talk about stress, we talk about domestic violence, we talk about, violence, kicking, issues of food, clothing, shelter. When you put all those together and trying to mature a child in the womb, that's kind of hard.
Well, and funny you mentioned all of those issues, because those were my issues: domestic violence, homelessness, joblessness. I didn't have a steady place to stay. At one point I was with the father, but he was into drugs and he abandoned me in a hotel, and I didn't have very much family to rely on. I'm living in hotels when I can get them, whenever he would pay for them.
So I want to congratulate you for having this baby.
So I had this baby. I had this baby dealing with all of those issues. And the thing of it is I'm dealing with all of these issues, but I am afraid to let my doctors know that these are my issues, because my doctors don't look like me, and I can't trust these doctors. I don't know what they'll do. I don't know if they'll try to take my first child because I'm not in a secure place, because I don't have, a place to take my baby home to from the hospital. That was my situation. I didn't know where I was going to be when I got released from the hospital. I had already hooked up with the Black Infant Health Program. And, they in that particular program, they monitor you. But because I was so sick during my pregnancy and I was in and out of the hospital, I never really got a chance to connect with them until I was staying in a hotel, and I was once again, went through the domestic violence thing, and I said, no, this is crazy. I had to think about my child, and I called the lady from the Black Infant Health Program in Pittsburgh, and I just kind of, I didn't know how to tell her. I didn't know how to tell her, and it just came out somehow. She kind of pulled it out of me, and she said, you know what, pack your stuff. I said, I'm gonna pack it, where am I gonna take it? She said, don't worry about it, pack it. She came, she picked me up. She said, just tell me a family member. I said, they already said I can't stay. I don't care. Tell me a family member. I don't care where they are. I'll drive you. And she drove me to a family member, and she talked to them and said, look, it's a bad situation. She don't need to be there. you know, you're going to have to help her. Like, you have no choice. I can't leave her in that situation. And so she basically helped me escape that situation. I got my life together. I started going to school. I moved back out here. And when I was pregnant again, I reconnected with Black Infant Health because they were truly a lifeline. So that's my story. That's where my interest came in. And so as I've gone through school and stayed connected with the organization here in Berkeley, I just have such a passion for it because, like I say, they were a lifeline. And so I can't help but to be there in whatever way I can.
So one of the things we talk about is, you know, community involvement, giving back. I was going to ask Dr. Alexander to comment on, is this a story that's common? Is this what you hear? I know we're all individuals, but this is a common story that you hear in the program.
Absolutely.
Yeah.
An additional thing that Starla had relayed once before from another client was no food. And one of the nice things about the Black Infant Health Program is when you go there, you're going to get some food. And they're very friendly, family-like, and eventually you become a part of the family. And when you become a part of the family, you defend the family.
So when we look at California's budget, we're talking about cutting these kind of programs. We're talking about the reduction in services. I can't even phantom why you wouldn't want to have a mother in this family-oriented American society bring that child to a term. What would you give for those factors not in place for that child to be a preemie? Because certainly we talk this American dialect, but when it comes to action, we're closing women's shelters, we're reducing funding to programs like this. So I got a question in that discussion. So this, to me, one of my pet peeves, nationalized health care. You know, we need a single payer program. We need a public option. I need you not to worry about you going to that doctor and after that getting the bill.
Oh, yeah. Yeah.
That frightens me to heck.
Yeah.
So we want you guys to call. The information to get a hold of the Black Infant Project is on the screen. We want people to get involved in this on any level you can, financially, socially, politically, morally. You know, prayers are great, but it takes wishes but it takes more than wishes to do the dishes. So be involved and just not a verbal discussion. Resources.
Could I just mention one thing of
Sure.
what happened in the state? We weren't sure what was going to happen with this budget. We were getting ready for
No one was.
we were getting ready for some difficult times. But we could not predict what happened. All of the state funding for Black infant health was cut. All. There are 17 jurisdictions that have a Black infant health across the state of California. 17 health jurisdictions, 17 counties in the city of Berkeley. And they were all cut. So there is no explanation other than total negation.
I was talking to Sandre Swanson, and he kind of defined, because he's one of the folks that voted against this present budget, felt it was very anti-people, anti-human, anti-woman, anti-anti. And what he said was, what is this society, as President Barack Obama, what is society's priorities? Well, can't be healthcare. We don't want that, we're cutting that. Can't be education. We're making it so you can't afford it. But what we are doing is promoting a criminal, a prison industrial complex that is the #1 industry in the state. That sounds like our priorities right now. And that's kind of sad that a state that would be, you know, a country would be between ninth and infant mortality, and a state would be, at the bottom. Jesus crazy. What are some of the ways that folks can help the program? What are some ways that they can get involved? We always know money is an issue, and yeah, if we had enough money, that'd be great. But what about that human issue? What do you think people out there say, I want to get involved? It's something I want to do. I know there's been a real increase in volunteerism, and this is, you know, pick a home. Go with it, you know. I think that's really, really important. What are some of the things that the project needs?
Well, let me mention a couple of things that I know of for sure.
Okay, Don.
So you said financial. Financial is absolutely critical. What we do know is that whatever money we're able to generate on a local level, we can get additional dollars from the federal government.
Matching
So
funds.
that's the way the budget works. We
Okay.
get matching funds. So if people are up to donating, if people have those bucks, that's good. But in addition, we have a program where we feed people. We help people. And so if they call the number, they will know what kinds of foods we might need for what kinds of meetings. We have several types of meetings, and Starla, I'll let you talk about the different kind of meetings we have, but they all require food, different kinds of food. Fresh foods, and fruits and vegetables are the best. Juices, etc., waters, etc., are the best.
So you just heard
we
it,
also-
folks. Simple. What, food? I know we can do food, right? Anyway.
We also used to have a bank of things, clothing and stuff for children, because that's another thing, it's very costly. So people should call the office and find out exactly what are the needs at
The
this
director's
particular time. Ramona Benson.
Ramona Benson is available. We are flashing her number. It'll run at the end of the show. Please get a hold of her, contact her. Let her know
Right.
that you saw the program and you're going to help her. Program.
What do we need? Like she said, food. We hold 3 different meetings for 3 different groups, and I know for
Any men's groups?
no men's groups. I wish. But you know what? Before these budget cuts went down, that is one of the things that they were in the process of starting was a fatherhood program, because there's another BIH that does have a fatherhood program, and we want our own fatherhood program.
Yeah.
We want to involve these
There's
fathers.
been some good success to it. I think that, the young African American father is much maligned. And, again, fatherhood is something that does not have a manual to it, although they say they got manuals now for, Fresh 5 and stuff. But my last check, that's an individual thing. So, we'll store the manual somewhere anyway. What's fun about it? What's fun about doing this kind of work? What gets you up in the morning besides the fact that you have to get up?
Well, I like a good fight.
Ouch. Okay.
And whenever there is a need, whenever there is injustice being done, I'm there. Because this particular area of women's health, infant mortality, low birth weight,
Is our future.
for whatever reason, has been an area since the Coalition to Fight Infant Mortality. We started it in about 1972. And we've been fighting this issue ever since. And it has to do with the fact of who is getting hurt the most by infant mortality and low birth weight. And it's poor folks and folks of color, and mainly black folks.
In fact, we do some math on it, a preemie hospitalization for 6 months, you can't even talk about the dollars.
Yeah, the average in terms of preemies is $50,000, and that's for a preemie for 1 day to a preemie for 6 months. So the average is probably more at this point.
Of course.
Well, I can tell you, my daughter's 1 month stay came to about $500,000.
There you go.
Outta
There you
here.
go.
Yes.
Get out of here.
I saw those bills. They sent them to
Nationalized
me.
health
They
care,
sent you
single
bills?
payer,
Girl. Oh, ouch.
first choice. Come on. We need to make health care a right, not a privilege for privileged few. Anyway, no one should have to pay $1 million for anything. This is what they want to pay for.
But George,
Yeah.
what has been most exciting about this program is to see.
Now, you're in it, first of all.
Yes, well, right now, yes, I'm on the board. But what's so exciting is to see people like Starla, women who have pulled themselves up, become a part of the program, contribute to the program, go on and get their degrees. Working towards their bachelor's degree, working towards their master's degrees, who didn't even know this might be able to happen in the future, through the support of each other in the program and the support of the program. And it's that peer supporting each other stuff that is so critical. How do you build that? That's what's so exciting to me. How do you build that feeling within a person to be able to help another person so much that they want to go to college and get into college and go and finish and they have a baby or two while they're doing it.
Certainly, there are
whoa.
there are some external factors, but it's always internal. Starla's a very strong woman, and she comes from a very strong stock. She comes from the original woman, so I would expect no less of her. I told you it was starting. So within that context, this is true. This is something I think that women should relate to. You know, not just. And I think that men
Right.
that in my case, I have nieces and have a son that's 33 and a granddaughter that relate to the fact that that birth and what a magical event that is. In fact, as I'm thinking about it, I want to dedicate this show to my sister who had her child, Kayla, my niece, under some very extreme physical situations. And she listened to everybody but me, which is a good thing, because she was right. So I want to say hello to her and to all those women like yourselves that are fighting this good fight. You know, I want to dedicate that show to them. What do you see as some of the challenges now that you're becoming a board member? You know, is it to never fall back, or is it to keep progressing, or what's on this tap for Starla?
Well, my biggest challenge is that I love to be involved, but I'm finishing up my degree. I'm looking to go into full-time work, and so my biggest challenge is just not having enough time. And then aside from that, there really are concerns and worries about the future of this program. Where is this program going to be? Because I just don't know. Well, I may be in the same place, but I can say that there are some of the women who may not be in the same place that they are now if it was not for this program. So that really takes a toll on me thinking about that, because this program is, I know the importance of this program. I talk to these women, I know what they go through, I know what their particular challenges are. I know you shouldn't take your work home with you, but I do. I carry these women with me, I carry these women in my heart, and so that's a challenge as well, knowing that a vital service, you know, we're fighting to keep a vital service.
So how do we heal the healer, huh? My goodness. Dr. Alexander?
Keep the healer healthy.
Keep the healer right, yeah, really.
The healer healthy.
All that. All that. Well, I mean, this is the kind of show that I wanted to have. I think Berkeley has a jewel in an organization like the Black Infant Health Program. And we trumpet it because we think it's important. You ladies are the best that we have, and to not hold you up in a shining light, I think is just a dim view of the world. That tenacity. It seems like both of you have that tenacity. That kind of like, I ain't gonna give up. Where does that come from? Either one of you can tell me.
That comes from my family.
Yeah, family and that hard knocks life where you just keep you just kind of.
It's not a Jay-Z cup phone.
Oh, no.
Life for us. Okay.
But I guess, as you said before, it is something kind of within. It's just something within. There's a certain strength that you just have to draw upon to take yourself through trials.
Okay. So
I had a fortunate circumstance, fortunate or unfortunate. When I finished college, I wanted to become a doctor, and I applied everywhere. Yeah, I applied everywhere, and I was turned down everywhere. Okay, and at the time, I was a part of the movement. So this is a shout out for the political movement, for Martin Luther King, for the Civil Rights Movement, for affirmative action, because when that happened, I won't give up my age, but when they passed affirmative action in California, I reapplied after 5 years to medical school, and I got accepted everywhere with scholarships. And I think that if it hadn't been for that movement, that wouldn't have happened. So I give a shout out to the movement
a green
as
woman
well
like
as my
yourself
family.
would not be able to go to medical school just because.
I was black, and I was a woman. And in 1959, that was a no-no. You just don't do it.
You were a woman too, so I don't know what you're talking about. You were a woman, a black woman trying to go to medical school.
Yeah.
Duh.
Yeah.
Anyway, right? See,
So.
like again, folks be wrong. So, and what I also, from talking to both of you, Dr. Alexander had been in a lot of discussions in Berkeley around public health access and healthcare access and healthcare disparities. She's written a couple of interesting papers, and if you ever get a chance to read some of her information, exciting. Starla, we communicated by computer, and I sent her a whole bunch of information, and she read it. She read all of it.
Yeah, I was scanning through it.
Because I said,
Yes.
oh, and we was cool. What do you think that men need to do about making sure our babies come into the world for their turn and minus stress?
I think what men can do is it's pretty simple. Just be there. You have to men can understand how stress can affect not just the mother's health, but the child's health. And I don't care what you're going through, whatever kind of drama you're going through, you have to stay focused on the child and the health of the child. So whatever it takes, if you got to rub feet every night, if you got to rub backs, if you have to hold back your
Pickles
anger,
and ice cream.
whatever
More
it
ice
takes.
cream than pickles.
So you take care of the vessel at that moment. You know, the mother is the vessel, and you take care of that vessel, so that she can take care of that child inside and have a healthy child.
I'm gonna let that be your final word, Dr. Alexander. Final word.
Final words. I think it's very important that we all acknowledge when a program is a positive influence on a community. This program has been an absolute positive influence on the Berkeley community. And as a result, I think the Berkeley community will stand up and support the continuation of the program. And I will be there for the good fight for as long as it takes.
Well, interesting enough, I don't usually ask Berkeley elected officials to do too much of anything. But if they watch this tape, which they tell me they do, they're going to have a discussion and be calling you guys and seeing how they can help. And the folks that sell on the board know who I'm talking about. The mother folks, don't worry about it. You'll get with it. I want to thank you both for coming on.
Thank you for having us.
Where's the program again? Where's it located? We didn't even say where it's located. Oh, goodness. Where's it located?
1645 Oregon Street.
Oregon.
In Berkeley?
In Berkeley.
Okay.
It is right behind McGee Baptist Church.
Okay.
Avenue Baptist
Again, what's that
Church.
again? 1645?
1645 Oregon Street.
Very good location. You know, I think that anything you can do to help, you know, when we talk about the first mother, we talk about an African woman whose descendants populate this world. Be no better that those women have access to health care and the ability to bring maybe another Martin or Barack Obama or Sissy Houston. Yay! Okay, anyway. But I want to thank you both for coming on. Timely subject, great program. Please support any way you can. I want to thank you both for coming on.
Thank you.
I want to thank you for bringing light to a very dark world. I want to thank Marcus in the house. He got here. He the man. You know, Marcus is the man, and wherever he goes, I'm going. I swear. Thank you very much. Again, I want to thank you for bringing light to a very dark world. If visions are seeing things you haven't seen, you folks are truly visionaries. Thank you, Dr. Alexander. Dr. Starla.
Thank you.
Yeah.
Broken hearted, I surely came. Sons that were slain for minimal gain. Youth that can't read, speech that can't talk.